Hi, I'm Patricia Greenberg, and this is Eat Well, Live Well, Age Well on KABC 790 AM, where we talk about all things aging well. Well, a couple weeks ago, we had on my dear friend and Medicare expert, Elka Soussana, and she's back today to talk to us about Medicare benefits for veterans. March 29 is National Vietnam Veterans Day, and I thought it would be a perfect time to talk about the benefits that these servicemen and women are currently getting, or not getting, to take care of their health needs as they're reaching their later years, because that population is aging. On that day in 1973, Military Assistance Command Vietnam was disbanded and the last U.S. combat troops departed the Republic of Vietnam. The last unit was elements of MACV's Infantry Security Force, which is actually the Special Couriers. So fast forward to today, coming up on March 29th, these men and women, the largest sector of seniors that this country has ever seen. And I'm also pleased to announce that I will be running a 5K this coming Tuesday to honor these brave men and women for an organization called Heroes Bridge. Not doing any fundraising. It's just actually a nationwide movement to redo the welcome home, something that they didn't have the first time around, and we're going to try to get it right this time. So I invite everybody to run or walk virtually and make sure that Vietnam veterans in your town see their welcome home. So getting back to our subject here, healthcare costs have been growing out of control in the United States, and I'm sure everywhere, for many, many years. And it feels like a runaway train that nobody can get a handle on. So when speaking with people 50 and older, the subject that always comes up is, how am I going to pay for my healthcare? We discussed this last month when Elka joined us. She's the owner of Simpler Horizons Insurance, and she's a champion for older people who need help navigating Medicare. And today we're going to focus on the needs of veterans of all American conflicts, how they can benefit, and how to go about it. Welcome, Elka.
Thank you, Patricia. Thanks for having me today. It's really an honor to speak on this subject and to speak to you.
So, of course, we talked a little bit about Medicare, but let's talk again briefly. What is Medicare, and what are the unique aspects of Medicare for veterans?
So Medicare and the VA are actually entirely separate systems. There's no coordination of benefits between them. Medicare specifically is a senior-focused federal health insurance plan that started in 1965 with a goal to provide health insurance to U.S. citizens over the age of 65, regardless of income or medical history. Now with the VA, which is the Department of Veterans Affairs, that's also a federal agency that provides healthcare services to eligible military veterans. Services for vets are provided at specific VA facilities. I just checked, and last I checked, there are about 1,700 different clinics throughout the country. So if you're a vet and you've got Medicare, you would use your veteran ID card at a VA facility, or you'd use your Medicare card if you went somewhere else.
So they're two separate plans in a sense. You can't use your VA benefit at a non-VA sanctioned healthcare facility.
Correct.
Okay.
Correct.
And again, like Medicare, what is the time frame in which you can apply? I mean, the veterans, you can explain that a little bit. I know there's age brackets, but it might be a little different for veterans.
Well, so for veterans that have disabilities, that could be different. For Medicare specifically, if you're not, once you hit age 65, you generally become eligible. If you're under 65, you could qualify based on certain disabilities. So that could be, for example, Lou Gehrig's disease or ALS. It could be end-stage renal disease, or if you've received Social Security disability income for 2 consecutive years or 24 consecutive months, then you also qualify for Medicare under 65. Now with the VA, they set their own different priority levels of coverage according to different factors. So that could be income, or most often it's related to any medical condition they may have had based on their military service. It may have originated from their military service. So a vet could be determined to be 100% disabled, or maybe less than 50% disabled based on their conditions. And their health coverage actually would differ through the VA based on their percentage of disability.
So we talk about there's the VA coverage and then there's the Medicare coverage. Is the
Right.
cost of Medicare itself negotiable based on income? So in other words, when you become eligible for Medicare, is that just based, you're 65 and you get what you get, or is it variable depending on where you are in life?
Great question, Patricia. So most people actually don't pay a premium for Part A, which is hospital coverage. If they worked in the U.S. and paid Medicare taxes for at least 10 years, they earned their Part A and there's no premium associated with that. However, for Part B, which is the outpatient medical coverage, the standard premium amount is $148.50 for 2021. However, that is defined by your income level. So the higher income you have, the higher that monthly premium will be. The lower income, if you're on a poverty level, then the lower that premium will be.
But
and
it's still
all based
there
on your tax returns.
but the coverage will always be there regardless of your income.
As long as you pay the monthly premium, whatever your income is determined to be.
So you have this kind of interesting discussion of, you have your Medicare, you have maybe your veterans care, your veterans benefit, and then you have parts within Medicare. So if you don't mind just doing another quick sort of breakdown, because I know prescription drugs become an issue, and is a doctor visit covered because it's a wellness exam, a wellness visit, or are you going for a particular condition? I know we only have a half an hour here today, but if we could just break that down a little bit for me.
Sure.
Okay.
So like I mentioned, Part A, that's your hospital coverage. So I want people to understand what that means. To simplify it, think of it wherever you spend overnight. You're getting overnight care. So that could be a hospital, it could be a skilled nursing, it could be a hospice service. So that's Part A. Part A does have costs associated with that, including deductibles, co-payments, and so on. Assuming you have no secondary coverage, you only have original Medicare. Same with Part B. Part B, to simplify that, anything outpatient where you're not staying overnight. That could be your doctor visits, lab work, medical equipment, seeing a specialist. Those would be all fall under Part B. Everything other than preventative, like you mentioned, would have a copay associated. So preventative is covered 100%. Everything else, there is a huge gap, which we call the 80-20 gap, where Medicare covers you 80% of the cost, you're responsible for 20%. So in general, if you go to the doctor, it's $100, copay for a general doctor visit. Medicare would pay $80, you'd be responsible for $20. But the important thing is there's no ceiling to that. There's no cap. So if it's a $100,000 procedure that you're having, Medicare will pay $80,000 and you will be responsible for $20,000. So that's why getting a secondary insurance is really important.
Yeah, it sounds good on paper that they're going to cover 80% of it, but people forget what it really costs to have procedures done. It's astronomical. So,
right.
So we want to have Medicare, we want to have secondary insurance to cover that, and the veterans benefits are a separate issue.
Correct.
So how does that work?
So let's talk about the drug coverage for a second.
Okay.
That's sort of like a separate entity in itself. Medicare does not cover drugs, which I forgot to mention on your previous question. So now when it comes to veterans, the VA will cover medications. So veterans can choose to either opt into a Medicare drug plan or just stay with their VA coverage. However, one thing is, remember in the beginning where I mentioned one, it doesn't cancel out the other. They're independent of each other. So technically someone who gets VA benefits can also take advantage and get Medicare drug coverage and see which one works best for them.
Right.
Many times the VA can abruptly decide they don't want to cover a certain medication that somebody's been taking for years. Or, which happens more often, is they add extra restrictions on obtaining authorizations. For example, it could be somebody who suffers from ADHD or PTSD or other mental health issues. They add these extra levels where you now have to go through different steps to get your medical prescription. So having that secondary Medicare prescription drug plan can sometimes eliminate all that extra paperwork that you have to go through. It's important to sort of compare what would work best for you, what would give you that flexibility.
So the thing is, a veteran, as much as they're getting benefits, really would hopefully have to sit down and outweigh which avenue is the best way for them to go. Hi, I'm Patricia Greenberg. You're listening to Eat Well, Live Well, Age Well on KABC 790 AM, where we talk about all things aging well. Whether you're just learning about Medicare or entertaining a change in coverage, Elka Soussana and her team at Simpler Horizons will treat every client like family. You can reach her at www.simplerhorizons.com. And today we're talking about Medicare in relationship to veterans coverage because it's very confusing. And unfortunately, sometimes as people get older and they become a little more infirmed, this stuff gets harder to manage. So let's try to get, clear, concise information out to people as we're all aging, just to see how this works. Now, secondary insurance, you alluded to it earlier. Let's talk about how that plays a role in the VA benefits and the Medicare benefits, both Plan A and B.
So unless the veteran is part of a specific type of VA plan, which is called TRICARE or CHAMP VA, that applies to certain levels of disability, of VA disability, and they determine that. Other than those two programs, without hesitation, a veteran should absolutely get a secondary Medicare plan. And I mentioned earlier, Medicare and the VA health system work independently of each other. So VA coverage would pay for medical services if you go to a VA hospital or a doctor. If you need care elsewhere, you'll end up having to pay that full cost yourself, even in emergencies. So as an example, if a veteran is taken by an ambulance to the nearest hospital that's not a VA hospital, the veteran is required to advise that hospital that they belong to the VA. Mm-hmm. If for whatever reason they're incapacitated, they're unable to speak for themselves, they don't have a spouse there to speak on their behalf, and they cannot communicate that to the hospital within 72 hours of being admitted, the VA will not pay that bill, regardless of level of disability.
You can't do it. You can't do it retroactively.
No.
Oh my goodness.
And you have to tell them within 72 hours. So if they had Medicare as an additional option to their VA coverage, then you're covered even if you go to a non-VA provider, especially if you've got a secondary. So just based on that emergency scenario, that's also an important point to consider. But especially even if it's not an emergency, what if you live really far from the nearest VA facility? If you've got Medicare and a secondary plan, you have the option, like I said, you can go to a non-VA facility that might be closer to your home.
And are the organizations, are they in contact with each other, or is it, again, the responsibility of the veteran, I'd imagine, to coordinate what they're getting from the doctor that they see through Medicare and the doctors that they see through the VA? Because I'd imagine there's a lot of things that either double up or slip through the cracks, and people aren't. I mean, is there liaisons or communicators between the two organizations?
I think between those two organizations, they don't really communicate with each other. I think in an ideal world, maybe they would, but they're totally separate federal programs. So if you go to the doctor, it's the VA doctor. Like I said, you walk in with your VA card, and that will be fine. If you go to a facility that's not a VA clinic and you walk in with your VA card, they won't know what to do with it. So you've got to walk in with your Medicare card and possibly even your secondary insurance if you've got that. So you might very well have 3 different cards that you're juggling around in your wallet.
That's the problem. And, with people who can't navigate that becomes extremely difficult. And so talk about what the secondary insurance, we're saying it's necessary. You have a VA benefits, your Medicare, and your secondary insurance. And I can see where people are so confused that they don't have all their ducks in a row when it comes to this. So what does the secondary cover?
So there are 2 different types of secondary plans. You could have a Medicare supplement plan, which is most similar to what you would remember as a PPO before you get on Medicare, where you have that flexibility to see any doctor you'd like outside of any network. You could see a doctor anywhere in the country as long as they take Medicare. That one gives you that flexibility. It generally comes with a premium, and that premium increases with age. The other secondary option is a Medicare Advantage plan. Again, that's an HMO plan where you do have a network of physicians. You have a primary care doctor who is your quarterback. So you go to that doctor if you need a referral to see a cardiologist or you need a referral to see a pulmonary doctor. You would see your primary doctor. They give you a referral to see somebody within the network. With the Medicare Advantage HMO plans, those generally come at a much lower cost than the Medicare supplement plans. So it's important to understand each person and what their needs are and what would be best suited for them. And then specifically for veterans, there are actually Medicare Advantage plans that are designed with them in mind. What veterans don't know is some of those plans even give you back part of your Part B premium. There was a plan that I was just referring to yesterday with one of my clients that would give a veteran back $90 a month for their Part B premium. And a lot of those plans actually include additional benefits, dental, vision, hearing. So it's really important to sit down with somebody, understand what it is that they need, work with a representative who represents many different insurance options so that we can give you the most unbiased recommendation based on your specific situation and needs.
So to add more confusion to the pile, if you have a secondary and you have a good secondary, is that secondary honored at the VA hospital?
No.
Oh.
It has totally not anything to do with it.
So the advantage is when somebody's not being treated by the VA hospital.
Exactly. So that would be, again, the most common situation is when you go to the VA, what I hear from my clients is you have long waiting times. For example, let's say you're being told you have a specific condition, you need to get an MRI. You have to wait in line at that VA clinic along with everybody else that needs an MRI, and that might take a month or maybe longer. Whereas if you've got Medicare and a secondary insurance to Medicare, you can now go to the facility of your choice or that you've determined is closest to you and get your MRI done over there, as an example. So it's sort of a win-win situation.
So when you are going, this has always been a question of mine as people age and they move in with their children or they move to another state or they downsize. So they sell everything that they have and they say, okay, I'm going to go retire and I live in California. I'm going to retire in Florida or I'm going to retire in another state. How does all of that transfer from state to state?
So a move is considered a special election. There are a lot of different special election periods that people can take advantage of once they start with Medicare. So if you move, you don't have to wait until annual enrollment period to switch your insurance. If you move to Florida from California, you then have an opportunity to make a selection and choose another plan that'll give you coverage in Florida. It's also, there's so many different special election periods to consider. Besides just a move, you could have a chronic condition, which could switch you over to a different plan. You could have low income, qualify for low income for the first time, or maybe you just won the lottery and now you came into all this money. That would bump you out of a low income subsidy, and then that would be another qualification to move into a different plan as well.
But you have to do all the alerting. You can't move to another state and hand in your Medicare card and just assume it's going to be accepted.
Correct. You absolutely need to notify.
Okay. And then with the secondary, does that change a lot from state to state? Is that really something that is going to cost a lot more in certain states just by nature of the location?
Yes. If you're on a Medicare Advantage HMO plan, that one will actually, if you switch even out of counties, that will likely be canceled on you. As soon as you notify Medicare and Social Security that you've moved, you have generally 60 days to switch into a different plan. If you don't, you'll be left without that secondary coverage. So it doesn't even need to be to a different state. It could even just be from county to county, especially if you move out of state. That's a given. And then in terms of the Medicare supplement plan, that does give you coverage throughout the U.S. So even if you do move, generally your original Medicare supplement plan will stay with you even if you move out of state. However, your drug plan will not.
Okay.
So you will have to get a new drug coverage in the state or in the county that you move to. Again, those are the types of things that I spend hundreds of hours a year learning, figuring out, understanding how it differs from place to place. So it's my role to help somebody navigate through that.
That's why I can't, for you listeners, I can't encourage you enough to please get help with this. I know that we think, we don't need help. I could read the instruction manual myself. It is so complex. It's so difficult. And if you find yourself in the position that you are a veteran or you're just somebody listening wanting to learn about Medicare and the secondaries, please get help for that. Just let somebody else navigate it for you so you don't have to spend endless hours trying to, figure this all out. Now, two questions I had also coming up. We're getting near the end. We have a few more minutes. If you're a veteran, can you go to any VA in the entire country and get care without question? Or do you have to register in a state?
I'm pretty sure, to be honest, I don't know that answer 100%, but I'd like to think that you could, but I would have to go in and verify if that's the case or not.
The only reason I say that again is if we're talking about traveling, so that's VA, and we will look into that for you. But the second question is, if you're on Medicare and an appropriate secondary, and you're traveling and you are hospitalized while you're traveling, what happens there? Does those benefits transfer to that emergency setup? Is there something you can petition or appeal if you don't have coverage in that state to use your current insurance?
That's a fantastic question. Most plans, regardless whether it's HMO or Medicare supplement, will give you emergency coverage. If you're on an HMO, generally you might have a copay for that. But as long as it's a true emergency, and even some plans will cover you just for urgent care. But if it's just not a true emergency, if it's something that you just feel like you want to go to the doctor to check on something, a rash, or not really an emergency, and you're on an HMO, you would have to go back to your service area to get that coverage. But in an emergency situation, you go to the nearest hospital, no matter where you're at in the country, and you will be covered by your secondary plan.
Elka, I don't know if this is universal and if it's out of the wheelhouse, but every time I get you on the phone or on the air, I just can't stop asking you questions because you're a bottomless pit of information. What is the legal responsibility, if you will, of the emergency room when someone shows up? Are all emergency rooms required to treat people when they come in, regardless of their insurance?
They are required to treat people when they come in. Their insurance is just a billing mechanism. So you go in and you've got a situation, you're going to be given care. However, who's paying for that care really depends on what your insurance situation is. Emergency room technicians they're not involved with that.
Exactly. I was going to say, you have chest pains and you need someone to look at your heart right away. Nobody's going to sit there and say, let's fill out an insurance paperwork. They're going to treat you first and ask questions later. So that is something that, we always tell people to be prepared in case of a catastrophic incident that, you don't know what's going to happen at any given time. And you get brought in and they need to take care of you. And then you get a bill for $50,000. I was just there for a couple hours, but the tests they run can be extremely costly. And so, again, everybody out there, please reach out to your local VA, which VA stands for, by the way, Department of Veteran Affairs. We were talking about that. And there is not one on every corner. I mean, you have to know where your location is, and that it's very, very important to know your rights, know your benefits, know what they can provide for you. Elka, I can't thank you enough for joining us. Elka Soussana, she's the owner of Simpler Horizons at simplerhorizons.com. You can reach out to her also at 866-900-1957. You can also email me at thefitnessgourmet@mac.com if you want some more information on how to contact Elka. It's a much, much needed service. Elka, before we go, I also like to ask all my guests, what do you like about getting older?
I'm just happy to be healthy, to be active, and to be able to give back to my community.
That's good. And, again, what you're doing is just a wonderful service. So I don't know if happy's the right word, but Vietnam Veterans Day is coming up on March 29th. And if you know someone, or even if you don't, just reach out and give a shout out to those who served for us, because they risked their lives for our country. And I just want them to have the benefits back, and of also the love and support that we can give them. So I just want to thank you all again for listening to Eat Well, Live Well, Age Well on KABC 790 AM. And please tune in again for our engaging discussions on all things aging well. For feedback and topic requests, please contact us at www.eatwelllivewellagewell.com.